watching it right now, don't worry, you can still access this interview on the YouTube channel. And the topic I'll be discussing this particular hour with my guest is the control of COVID-19 in Kenya. How effective has it been? And my guest is Dr. Goody Gor, a senior medical officer at NCRH Hospital. She's also the secretary, Central Region of Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU. Welcome and thanks for joining us on the show at this hour.
Thank you so much for having me.
It's quite very interesting because even I got some questions from some of my viewers and my fans, and they want to know more. So that is why you're coming up on the show is quite interesting. But let me start with this particular one before we proceed exactly to the questions. Recently, I'm quoting some of your statements that you made. That was in September 7, 2020. It was published in on a media outfit, Sonko News. The title of that article was "Government Lying About Flattening Curve." About flattening COVID-19 curve, and you particularly. You said that mortuaries are abnormally full, which means that the mortality rate has increased. We are not getting the right statistics. We are only claiming that the curve is flattening. How is it flattening? Now, that will not take me to the first question. How will you rate the responses of the government to tackle the pandemic in Kenya, and how truthful is the government as well?
I would think that they have handled COVID in a very political manner. They have handled COVID in a PR manner because, they have not even utilized the basics that we know about COVID. We may not know so much about it, but we know this, that if you have immunosuppression, that your immunity is down, people like hypertension, diabetes, cancer survivors, old people, they are prone to COVID. They should have taken steps to protecting those patients to begin with. But instead, we realized that we are lacking basic medication even for these patients. So while we are tackling COVID, we are still making them suffer for their hypertension and diabetes. So they never considered that. Then they are supposed to do mass testing for doctors. They did not do mass testing for doctors, nurses, or any other health worker. In various facilities in our country, when a doctor is exposed to a COVID patient, it takes almost 2 weeks for the results to come back. Surely, 2 weeks for you to know as a doctor whether you're positive or negative. We also go and operate on patients without PPEs. Even the masks that we are given in the hospitals are not supposed to last us 24 hours. They're supposed to last us 3 hours, but we use them for 24 hours. So I feel like even the basic things that the country could have done in order to prevent the spread of COVID, they were not able to do it. And in the mortuaries, when we look at the patients, most of them are patients who had history of hypertension, diabetes, and such. And because we are not testing in the hospitals and we are not testing elsewhere, you cannot ascertain that COVID-19 was not there. But I can say for sure that being in the healthcare and being in the hospital for long, we see how these mortalities come. And we can do informal research and you can tell what is happening. You can put 2 and 2 together. Yes.
Thank you. Now, there is another likely question on that particular one, but I would like to take you up with an interesting part as well, which is that now, even as the healthcare workers are taking all their effort and all the time to ensure that this COVID is brought to the to the BRS level, so that the economy will continue to strive and everybody will be healthy. How will you describe the effort of your colleagues in fighting this menace? Because there are information across the globe, globally, that We are losing doctors, we are losing nurses, we are losing healthcare practitioners. That means they are putting their life on the lines so that the world can continue to survive. So how will you rate the efforts of all healthcare practitioners?
You know, they say when you save a life, you become a hero. When you save 1,000, you become a doctor. When our healthcare practitioners, not just doctors, nurses, clinical officers, lab technicians, all of them, we are doing above and beyond for this pandemic, because the people who we are treating are our relatives, our great grandmothers, our aunties, our uncles. These are not people who can afford to fly out and access these medical services. We are putting our lives on the line. As I've said, we are working without personal protective equipments. We are working without the appropriate masks that we need. And yet you hear that tenders and contracts were given to various people and they have become rich as a result of that. But at the end of the day, people on the ground, they are dying. 10% of the mortality from COVID is from healthcare practitioners. 10%. We are already having a shortage of healthcare workers as it is. It takes so much time and money for the government and for the people involved to get a healthcare practitioner. For example, you lose a respiratory specialist. That is a person who has been in school and experience and all of that for about 40-50 years. By the time you replace a person like that, it's gonna take the country another 50 years to get such a person. We are losing very valuable resources that we cannot replace easily. And I don't understand why it is so hard for the government officials to understand that the same way you cannot send a soldier into a war without ammunition, without the proper gears, without guns. You cannot send healthcare workers into a COVID pandemic without giving them personal protective equipment. It's murder, to be honest, knowing that you're sending this person in and they may not come out. Countries like India, they have taken insurance on their healthcare workers about 6.5 million Kenyan shillings. But you can see in Kenyan countries and even most African countries, they are barely compensating their healthcare workers. In Kenya, you see, we are demonstrating every other day. Our salaries have delayed. We have shortages. We are not being trained. So we feel like healthcare workers, we've been short-handed, but we still keep fighting because we know that this is our duty. It's our calling and we have to keep fighting for our people. Yeah.
Thank you very much. I think we still have another section where we are going to talk about fighting and fighting, because sometimes some of my guests were sending me questions saying, are you an activist or are you a doctor? So we are still coming to that section on that part as well too. Now, it's very astonishing, as you have rightly said now, 10% is quite unfortunate and very astonishing. And uh, how did we arrive at this situation, knowing fully well that it takes time, the years of training, the years of experience, and losing them to COVID? I'll take you up from one of your statements that I also said in that September 7, 2020. You said it specifically and boldly that this is the statement, and I quote, "But we are expected to attend to sick with substandard masks and personal protective equipment." How did we arrive at this situation? Now, when I say how did we arrive, I'm not talking about Kenya alone. I'm talking about especially in African settings. How? Because I know the same thing is happening in Ghana, in Nigeria, in South Africa, and so it is very particular to all of us in Africa. Now, how did we arrive at this situation, knowing fully well that this virus we are talking about is deadly and it can destroy the whole system and killing all our experts with substandard masks and personal protective equipment? So how are healthcare professionals coping with all this?
I think the root of the problem is we do not have respect for our intellectuals. When the intellectuals in your country tell you that this thing is this way and it needs to be done in a certain way, We have businessmen as politicians and our supposed leaders, and they don't look at the welfare of the people. They are looking at how they can benefit, how their interests are served, and how the interests of their friends are served. And that is how we got here. We got donation from Jack Ma for, I think, almost all countries in Africa. But the, the equipments were stolen, and then they were resold at a very high cost. In Kenya, let me use Kenya, and I think even in Africa, I think less than 10% of people make $1 a day. Now you take this person in a hospital and you tell them that you are going to use 5 personal protective equipment on them, and each is costing 20,000 Kenyan shillings. Do you think this man can afford 100,000? That is about $1,000 in a day. What are you telling this person? You're just telling them to go and die. So I feel like as health workers, we have taken our Hippocratic oath: do no harm. How can I, very well knowing that I've been exposed to COVID, I've been treating COVID patients, in all my consciousness, go and operate on a mother? Surely, am I doing right by my patient? Am I doing right by humanity? How is that supposed to lay on my conscience as a person? As much as I'm a healthcare worker, I'm a doctor, I am also a human being, and I'm bound by the nature laws that all of you are bound by. The only difference between you and I is that I went and studied medicine, but I'm still a human being. So how are we able to mitigate that? And that is what I was asking. Are we so greedy that we are even eating the health of our citizens? Surely. And that is why we got here: personal interest and greed from our politicians, and lack of political goodwill. Yeah.
Thank you very much for that. That would now take me to the most another interesting part of it all. I want to don't mind me. I'm trying to quote some of your statements so that people will know exactly who you are, where you are coming from, and where you are going to.
Yes.
September 11, 2018, you posted a short note on your Facebook wall, and there were so many reactions from your followers and your fans. You were reacting to what really happened as at then with what Kenya government did by hiring almost about 100 Cuban doctors for 1 billion Kenya shillings. I don't know if I'm right, yearly. And this particular set of people are not even paying tax now. So it means there are a lot of things that is going on. So some of your followers commented and replied, and you replied that, Doc, we can't give up on ourselves. I will speak until I can't. I must give it a trial. Now that will not take me to another question. Who are you, Dr. Gore? Are you an activist, or you are a medical doctor, you are a mother, or you are both? Who exactly are you, and why are you into this activism?
I wouldn't want to put myself in a box. I'd like to say I'm a multifaceted being. I can do whatever I choose to do because we have the power to do it. I'm a doctor, and I think it all began when I started working, because in Kenya, we have to do a year of internship in a government institution. So when I started working in the government hospital, I was so surprised that there are people who cannot even afford Panadol for headache. They cannot afford very basic health services. And it really got me wondering, like, how can we not afford health? Health is a right. And if we cannot even afford health, surely then we have a bigger problem than we think. And that is how I started getting into things, and I started to see the role that I can play as a doctor and the role that I can play as a human being I feel the pain of other human beings. So my activism comes from the fact that I'm a human being, I'm a doctor, and I am grateful and blessed to be in a position where I can be able to speak up for all these people who cannot speak up for themselves. I feel like I am a girl of small town and village, and I see how people in the small town and villages work so hard. They're literally the backbone of the economy, but they cannot afford the smallest of things. And if I'm able to escape that kind of life and speak on a bigger platform so that people can at least access healthcare, then I will do everything that I can. And this is our country. If we give up on our country, that's how people can come from other places and take advantage of us. So we need to keep fighting for ourselves. We need to keep holding our leaders accountable and just keep using our voice for the best. Yeah. So that's where I come from.
Thank you, thank you, thank you.
Yeah.
Now, are you seeing yourself as an activist really, or you are just doing it because you feel like you want to you want to speak for the people as an advocate of the people, or because I want to really define it really if you are really activist or you are just an advocate.
I'm an advocate. Let me say I'm an advocate. I'm an advocate for health. I'm an advocate for healthcare workers. I'm an advocate for patients. I generally want healthcare better. So let's say that I'm an advocate,
Advocate.
yes.
Okay, okay. Thank you very much for that. Now that will not take me to another question. Um, how did you now combine your work as an advocate and then activism, then your professional calling as a doctor, and as a woman of the house, as a responsible woman? How do you combine? How do you navigate between those three things? Activism, professional doctors, and as a mother, how do you navigate?
Um, it all comes to having a strong character. My parents raised me in a way that I would handle whatever kind of life that came my way. And I realized that in life, if you take time to do the worthwhile things, you will always find the time. So I have divided my time in all those things. And as it turns out, all those things merge seamlessly. Because when I'm in the hospital, I'm able to see the problems that are there and then still have some time to speak up about it and still have my time at home. So I feel like everything that I'm doing is just merging well with each other. I feel like this is how you know you found your destiny, when everything that you're doing just, meshes very well with each other. So that's how I am able to manage.
Good
Yeah.
manage. Thank you. I would like to encourage you to do more. Then that will take me to what really happened yesterday. So based on that, I have to apologize to my viewers and my fans. We are supposed to come live yesterday, but unfortunately, my guest, as what she has just rightly said now, you heard it from her. She is an advocate. Can you imagine that? She went on another protest yesterday again. So that is why we couldn't come up live. We are very sorry about that. Now that will take me to another important question that people really want to know, your role and what really happened in that. Um, I'll take an expert from an excerpt from an article on the it happens in what do you call it, June 23, 2020. You in particular, you appeared at the Senate hearing to testify during the impeachment of the Kirinyaga governor, that's Anne Waiguru, and you happened to testify during the proceedings as of the impeachment. Then I want to make quote some of your statements. You said, and I quote, "I'm here to speak on the dilapidated healthcare system in Kirinyaga and on behalf of 457 healthcare workers who were fired." Now, the question is this: what what exactly is your role? What role did you play exactly in the impeachment of Anne Waiguru, knowing fully well that she is the governor of your state, you as a civil servant, um, and you went ahead to go and testify against a power that is on seat? What role did you play exactly?
Again, I spoke up for the people who needed to be spoken up for. The problem in that county was that they were not receiving any health services. It's murderous that you have a whole county of over 200, 300,000, 500,000 people, and you're unable to provide healthcare services. You're shutting down healthcare centers that are primarily put there to give primary health care, vaccinations, and whatnot. You're firing healthcare workers right, left, and center. You're not hiring more healthcare workers. We tried talking to the governor. We tried talking to all the people relevant in health about the problems that were going on, but they would not bother listening to us. Patients were dying right, left, and center. Now imagine you have gone to the hospital for a surgical problem. You've been taken to theater and you do not have any other problem except that one problem. They take you to theater, you trust these doctors, you trust these nurses, you trust your government for taking care of your health. You enter into that theater, and then they are supposed to cover you with some green linen so that they can start operating on you to create an aseptic field. Those linens, they have not been properly washed. They are stained with someone else's blood. What if that person has HIV? What if that person has hepatitis? And now your guts are on someone else's blood. When you come out of the theater, now you have the surgical problem, you have hepatitis, you have HIV. As your doctor, have I done right by you? If I don't speak up for those patients, who else is going to speak up for them? Mothers, they don't have a clean space to give birth, surely. In today's day and age, should we be discussing of lack of space for mothers to be delivering? And the governor is a woman. She should be feeling this pain firsthand. For the fact that you don't even care that mothers are giving birth on the dirty floors, that they do not have linens to cover themselves or their babies after giving birth, that even after children are born, because the place is dirty, immediately they have to be started on antibiotics. We have a problem. The healthcare in Kirinyaga was so dilapidated that someone had to speak up. And it's not the only county. A lot of counties have that problem, but it was the worst of all of them. And so when I had the chance to talk to the senators, to the people who are responsible to overlook the constitution of the country, I needed them to hear it from the horse's mouth that it is bad, that you do not respect your healthcare workers. How do you fire 500 healthcare workers and don't even care about them? These people have been taking care of you. You just fire them, you shut down hospitals. Are we, when we have governors who want to run their hospitals like an office, we have a problem. You cannot run a hospital like an office. A hospital is a specialized area. You need to employ specialized people who can guide you navigate this. And that is the point that I was driving home. We have healthcare workers. Employ them. Empower them. Let them do the job that they are meant to do. And that was my point. Let the governors give us the political goodwill, but don't come in there and pretend to be a doctor, because you will never know what is happening unless you're a part of it. So my role in it was to show that the governor needed to be held accountable for the lack of leadership, for the deaths of all those patients, for the emotional, physical, and psychological trauma caused to patients and healthcare workers due to the same. She has so much power, and she chooses to either misuse it by not listening to us, or not using the power at all by again not listening to us. I wanted to call her to task. Yes.
Thank you. Now, I actually want us to tell my viewers so that they have a glimpse or an idea of exactly what really transpired. Now, what happened? What was the reason for firing 457 workers then?
Last year, in May, we went on strike because the hospitals were dilapidated, labs were not working, radiological services were not ongoing. The healthcare workers, 3 nurses contracted hepatitis B from a lack of waste management and segregation. Then the what are they called? The casual laborers in the hospital, the ones who wash the hospitals, the ones who ferry patients from theater to wards, from casualty to wards, they were fired without being paid for 6 months. So the whole hospital was dirty. Toilets were full of waste. You think of the worst possible case. Even if you Google Kirinyaga Hospital, you will see the dirt. Yani, even in the ground where children play in the hospital, it was full of hospital waste. Even placenta was just lying around. So healthcare workers called the county to task and said, immediately hire the specialized casual workers. They need to clean up this hospital. We cannot work in a dirty hospital. The county refused. They said that they're not going to hire, and they said nurses should clean up the hospital. So, it was ridiculous. The next thing they'll say is that the doctors will clean up the hospital. Let everybody work for what they have studied, yeah? Let us respect each other. So we gave the county 1 week to sort out that issue. They refused to sort it out. As healthcare workers, we cannot continue working in a hospital that makes us sick and makes our patients sicker. It is against the Occupational Health Act. It's against the Constitution. I mean, it's a violation of human rights. So we gave the county another 1 week to either sort it out or we go on strike. They refused to sort it out and we went on strike. So after we went on strike, they decided to fire the healthcare workers so that they can intimidate us. So even as we speak right now, the hospitals are still lacking in all of those things. The citizens of Kirinyaga County, they are coming to other nearby states so that they can get healthcare services because it is still lacking. That was
Okay.
the reason for firing
For the
healthcare
final
workers, yes.
Okay, now
Yeah.
what is the current state of the 457 healthcare workers now? Have they been reinstated or we are still on the fight?
We are still on the fight. They still remain fired. Our case was taken to court, and because of mismanagement and the processes in the court system, they kept pushing and pushing and pushing the case. So we are still waiting for the outcome. As much as the case is quite straightforward, we are waiting for the ruling of reinstatement of the healthcare workers.
Okay, thank you very much. Thank you very much. Now that will now take me to what really transpired again yesterday. What was the reason for yesterday's protest as well, and where exactly did it happen? Because we actually had some chat, and you told me it. I think is in another place,
County.
not in another country, so that but you have the jurisdiction to be part of it. What's happens there, and why did you embark on another protest yesterday?
So yesterday's protest happened in Kiambu County. It's still a part of the central region. And the protest was primarily because of salary delays. It's been 2 months since the healthcare workers have received a salary. Surely in these COVID times, facing COVID, hepatitis, HIV, TB every day, and these people have not been paid. We've tried engaging the county. They promise us they'll pay us next week, but the payment is not coming. We decided to finally demonstrate because when it gets to a point where healthcare workers are now requesting each other, can you please send me 1,000, 2,000 shillings? I can buy flour for my child so that my children don't sleep hungry. Then now we decided we cannot work on an empty stomach. And we had to take it to the streets so that we let our citizens know that we are away from workstation, not because we want to, but we are hungry. Our landlord has locked our houses, and now we don't have money to feed even our families. We dehumanized, we are humiliated, and that is why we went on the streets so that we can sensitize people on our pains. Yes.
But is there any impact of the national body of KMPDU to be part of this protest? Because as a common saying, whatever happens to a fellow colleague, it should be a joint effort to solve the problem. What is the role? Why is the national body of KMPDU silent about all this?
They've been making several statements on the same, and they are trying to follow up on the same at the national level on the delays with the Senate statement of disbursement of monies to the counties, and the push and pull between the governor and the members of the county assembly. So there are still other political, let's say, games that are still being played, using the civil servants as the sacrificial lamb for them to get what they want. And they're trying to follow up on it. And I am hoping that we will be getting a solution soon out of it. However, what I was happy about in Kiambu is that it's all healthcare workers that came together, not just doctors, nurses, clinical officers, lab technicians, nutritionists, physiotherapists, all of them, because it affects all of us. And I've always believed that a particular issue in health cannot just affect one cadre. If it affects the doctors, soon it will affect the nurses, soon it will even affect the casual laborer in the hospital. So health should be looked at in a wholesome way that benefits everybody that is involved in it. Yeah.
Thank you very much. Then how do we now because there are, I think I still have another question pertaining to that. if all this problem is now happening and we are not getting it right, now I'm throwing this particular question to you specifically. What support do you get from your colleagues? Because I know you've been, you take all these issues of welfareism, you take it very serious to the extent that you appear in every part, in everything that concerns the welfare of the healthcare workers and some other, as well as the patients. Now, are you getting support from your colleagues, from other healthcare workers, or some of them are seeing you as you are trying to play hero girl or whatever?
I'm happy to report that I have a lot of support from my healthcare workers because they see that I am fighting from a point of realism. I am not hoping to get an idealistic country or continent. I'm not even asking for my country to be at the level of the World Health Organization. I am just asking for some humanity. If our healthcare system is working at 10%, then let it work at the whole 10%. Let it not be 0.1%. And that is what I'm fighting for. So even then they see I'm not trying to be a hero. I am just trying to get the basics: salaries, specialization, employment, basic drugs, so that if these patients, Adam, these patients sell their property, their livelihood, just to come and see you, the big doctor in the hospital. And you, as a big doctor in the hospital, all you have to tell them is, there isn't, we don't have, the government cannot afford. How, you're telling this patient basically go home and die. How long will you do that before your conscience cries out to you? And I've seen that a lot of healthcare workers really want to be a part of it, but because of the nature of our training, we are not able to speak up well. So now when I am able to speak up, they really support me and give me all this material and all this support when I ask from them. So I can say that the support is tremendous. Of course, you can't miss haters here and there, but all in all, I can say that the response is quite encouraging.
Can
Yeah.
encourage it. Yeah, that is quite good, very good. That will now take me to one important point that you have just raised now. Have you at any point in time have this security threat to your life, whereby you are fighting some power, some power, and even all this fighting is what the public can see that they are realistic, and they are things that are normal, that should be put in place, just like what you have mentioned, having drugs available, having all the healthcare workers in the hospitals, and the system should be running as expected. Have you at any point in time had this kind of security threat that, hey, if you try to do this, your life is under this? Has it ever happened, whether from the politicians or whether from any quarters?
Oh, yes, it has. It definitely has. Uh, um, Unmarked cars follow me. My phone is tracked. My calls are recorded, the usual. It's usually a part of it. But I feel like if I've gotten so far, I've gotten so far for a reason. And I have a role to play in this particular issue. So the threat to life is always there, but I am thankful to God that so far so good and that I'm protected. But it's always there. Yeah, there was a time I got into an accident, but thank God it wasn't so fatal. But it was a car that was following me, and I swerved and entered into a gutter. My car was seriously damaged, but I came out okay, so I'm happy about that. So these things are always a part of it. You can't miss people trying to threaten you to get you off course. Yeah. And
Okay.
anybody who has made a change in this world, they have had to fight such. They've had to find such, but they make it through. Yeah.
Thank you. And I hope you continue to be stronger and stronger all the time. Now,
Thank you.
I will ask this another question now. Ha- are you doing all these things to become a state governor in the nearest future, or you want to become the president of Kenya in the nearest future, trying to galvanize and gather people that will support you, and they will say, oh, we love her courage, we like her. Meanwhile, maybe on the other hand, you want to become a senator or a
Mm.
governor or a president?
Well, as we speak now, I can't say I have political aspirations. to do my master's in cardiothoracic surgery and then have my hospital, a hospital where it's a futuristic hospital where doctors and nurses and all healthcare workers are treated as they should be, and that translates into the patient care. A hospital that is not money oriented but patient oriented, because a lot of our private hospitals are money oriented. Even for the smallest of things, you have to pay $500, $1,000. I want to bring preventive health care to be a part of our health. However, if I get a chance to become a senator, a governor, or the president of this country where I am able to impact lives on a greater scale, I will be very much open to it. But as of now, I want to do what I can where I am.
Yeah, thank you very much for that. I think my president is hearing, I don't know, or someone else in government is watching this particular show. Kindly make Dr. Gor to become the next minister for health in Kenya, or to be somebody in charge of health in your county as well. So that is very interesting. Because sometimes a lot of people have this kind of mission at the back of their mind, but you have said it categorically and clearly on this show at this hour. You are not doing all this to become an hero. These are the things that is expected to be available in every healthcare institutions across the globe. Now, to go on a lighter note now, before we end our show, I read so many things about you on internet, about your beauty, about your charming, about everything. And on the other hand, I was asking myself, this beautiful woman and going into activism and as a professional doctor, and I was receiving this question that this are you also into modeling? Because sometimes when we see your pictures, when you share your pictures, we see that wow, you have this display that is like modeling. Meanwhile, all your pictures captured a very vital information about the health, meaning about self-esteem, self-encouragement, self-development, self-joy. So that might tell us that you are not really just sharing the pictures. But how do you combine all this, and how do you feel when you are doing that, knowing fully well that you have this role that is on ground, and at the same time, people are seeing you from another angle, from another perspective? Are you into modeling?
I'm not into modeling. No. However, if the chance comes up, I wouldn't mind, but I'm not into modeling. I want girls out there to know that you can be beautiful and you can be intelligent and you can be smart and you can be all these things. You don't have to be ugly to be intelligent. You don't have to be beautiful to be a model or to be a loose woman. You can be beautiful, go to school, become a doctor, become an activist, still have high moral standards. You can be the best version of yourself. And that can only come from self-love. They say, if you cannot learn to love yourself, you cannot learn to love anybody out there. So I feel like my care and concern and empathy for people comes from my love, care, and concern for myself. And that is what I encourage women and everybody else to do, even men. Love yourself and you'll be the best version of yourself. And that is my motto. Yeah. All work and no play makes Jill a dull girl.
Yeah, exactly. You're right. You're right. Thank you for that. Thank you for that. But I think I was supposed to ask this question before I ask this. The one you just answered now. That was I think on May 2019. You also threatened